Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Jean Ross. Good morning.
Good morning. Thanks for having me, Kim.
Well, I'm super excited. And so we talked a little bit before the show started. And you are the CEO and co-founder of Primary Record. And I know our listeners are going to be super excited about this. And so because we're going to be talking about organizing the chaos, how Primary Record supports caregivers and aging families. And really, I'm not sure if the title really does justice for what you do, because, when I was thinking about it, talking earlier, like we all have different doctors, different practice areas. And so we're going to kind of get you, we're going to tease the listeners a little bit, and then we're going to get into it. So, I know as a caregiver, my grandfather had 3 different doctors. My grandmother just had one, thank God. But when you're taking care of families, and you've got paperwork and you've got doctors, tests, things like that, what are the biggest pain points you see when families try to manage medical records?
One of the biggest pain points that I don't think we talk about enough is that you as a family member are not recognized in that electronic health record. I love the idea of patient-centered. I love that we are doing all of these things for the patient, but we need to be quickly shifting because now we're going to be having the most older adults we've ever had in our country. And we have a lot of folks that are taking care of their spouses or their parents or, being a niece that's jumping in. And so one of the biggest pain points that I have seen and we kind of just deal with as families is, look, you are nowhere in that electronic record. They pull it up and they just see your family member. You also probably didn't quite understand how to get proxy access to that information. So you're probably logging in as them. I think that's a huge signal to the system. Like, we are not making it easy for our families to get access to the information. So families are just swapping, oh, here's my username and password. Or they're getting the secondhand information, right? So maybe the parent is not quite ready to share information. So they're only getting the secondhand information. So that can be really overwhelming, especially if you're an out-of-state child that's trying to manage this kind of afar. The other one is, okay, even when we see the information, I think one of the problems and pain points I've seen for families is there's just a lot of information we don't understand. So we haven't done a really good job of, now we've given people access, all these electronic health record vendors were required by law to basically make patient portals and make electronic health data accessible to patients. And then, that's led to families accessing. But there's just a lot of anxiety of what families are seeing. And there's no tools inside those patient portals where it's really helping families understand, what does that mean for my family member, right? Like, and we've all written the email message back to the doctor about that red lab, because we all think red is bad, and they'll be like downplaying it. And you're like, okay, well, why is it red in the my chart? So that's kind of what I've seen with, when I think about the pain points that our families are facing, I think it's incredible as a nurse. Like, I always wanted my families and patients to have as much information as possible. But what I never realized until I stepped on this other side of the electronic health record and looked at it through the family's eyes, I realized how overwhelming it is. Yeah, it's great you have access to the information or you can access it, but what are you going to do with it? How does it help you, in this journey that you have?
Well, when I was caregiving, it was over 20 years ago. So you didn't even have portals.
No.
You had to go to the doctor with them in order to
Yep.
get any information. And so I was at, one doctor, then I'd go to the different doctor for the different problem, and so, but two, you think about, people like my grandparents, my grandfather, I mean, he had some idea about my grandmother's, medical conditions, but she never took him to the doctor. He never went to the doctor with her until she got really bad, so he wasn't privy to a lot of information.
Yeah.
And so how does primary record help that kind of dynamic?
Yeah, so something we've done is, so now that, we're on this trend of everyone seems to have a patient portal, so information has moved more electronically. And primary record exists because of a law that's called the 21st Century Cures Act. So it mandates that all of these portals are required to be able to share this information so that you as a consumer of healthcare can choose your own app to bring all this information together. So how we have done it at Primary Record is we think about a family's one place. So the design of Primary Record, we actually worked closely with families to design with a nurse's lens, knowing what are they going to need to be ready to face our healthcare system. So how it works in Primary Record is they make an account, and one of the first questions you're going to see in our app is this for you or for someone else? So you have the power in Primary Record to make your own profile. And if the family member that you're working with doesn't want to deal with their own profile, they can have you manage it in your own Primary Record. Or you may have, in your case of your grandparents, 2 different profiles. And then what we have is called Access, where families can share that view. So when I open up my Primary Record, I'll see my profile, and then my husband has shared his. So under a banner that says profile shared with you, I'll see him. So in one place, I can access my husband and then my information. But I'm a sandwich generation. So actually my Primary Record's a little insane. I've got a mother, 3 sons, 2 parents, him, and then we got our 2 dogs, because why not? We'll throw our dogs in there. They're a little medically complex too. So, but that is the design of it, is how do you kind of just create this thing of visually one place for families that they can log in. And that's probably my happiest screen, when I can pull up Primary Record and everybody's just right there in one screen, and I can click and act as what I need to do with that information.
So caregiving is stressful. And so there's so many moving parts, in that aspect of it. So when medication changes, if they're supposed to be doing something, if they have insurance deadlines, how can the better organization reduce that anxiety and improve that day-to-day decision making for the families?
Yeah, this is one I hear a lot, and I'll challenge the organization part. For me, we need to help our families get better connection, I think, is what can reduce the anxiety. I meet so many. I actually volunteer with a group called Daughterhood, and these are women taking on the caregiving of their family members. There's free circles for them to get support, and I lead one on there. And I just hear this constant blame and guilt because they're not organized enough. And I kind of get angry at that, right? Like it's a fault of them that they are unable to, get organized, and it's their fault that the doctor didn't see this because they didn't have it all organized or whatnot. So I guess my challenge is, it's to reduce that anxiety. It's trying to figure out how can we help our families have better connections to that information, and then how can we make sure that where that information is going has tools specifically designed for those moments, or for them to feel like they know. So in our system, we have a chat assistant. So it's being able to ask the question, what has this medication changed? My favorite thing on back to school night is I literally just have my Primary Record by my side. And as I'm filling out my school forms, I'm literally just going through my son's Primary Record and finding the doctor's number and all of that, right? So it's just trying to put everything in one place. And then the organization for us is a service that we provide, right? So connecting these different portals automatically ingest that information and organizes it, so you're not manually having to type. And I think that's one of the things I'm most proud of is how many less clicks can I make for our caregivers.
So what are the common mistakes that families make when they're trying to track medical information on their own? And how does your new platform help avoid the pitfalls?
So it was a little bit of when we talked initially, it's assuming just because you're the POA or that you are the family member that you're going to be able to access that information at time of crisis. I hear stories all the time because it does, especially if you just have that one doctor, it feels like, oh, there's the My Chart, I can log in. But we had stories where that account got flagged and the wife could no longer access her husband's My Chart because it's not owned by her, it's owned by the system, and they get to make those shots if they think something is out of whack. I had one of my hairdresser, her and her mom were just, her mom was just starting to change her POA for her to take charge of it, but then ended up in the hospital intubated. And she's trying to get information because now she's being asked all of these decisions. And she knows what her mom wants, but she also wants to kind of double check because it's not checking with what she's hearing and seeing, right? So, and she has her portal and she knows what kind of information she could be accessing, but then she can't access it. So what our system has done is, when POAs and your rights to information get questioned in the healthcare system, our tool has already taken that information out and allowed families that choice of inviting folks in. And so it kind of removes that barrier of being prepared or being able to kind of make sure that the right people have that information to make those decisions for you.
So it seems like that, you just talked about, in a crisis, having easily access that information is crucial. Because we see clients that, we do all the right documents so they can access medical records, make decisions, things like that. But sometimes, I'm sorry, let me rephrase that. A lot of times, parents don't talk to their children about medical conditions, things like that. I laughed and told my son, I said, okay, I don't have to take my blood pressure medicine anymore. He goes, yay. I said, that means I'm going to live longer. He goes, oh no, so. But if I didn't tell my kids, they wouldn't know that,
No.
and so so I was like, it's interesting, when you think about how life works, and information, my kids wouldn't know. They have no idea, because they probably don't think to ask, and I don't think to tell them most days. But I also know that as my seniors are getting older, a lot of times that you're not getting good information just
Yeah.
because they may have thought they said something and they didn't, and things like that. And Dewey talked earlier, I've got doctors in different practice areas. And I was just thinking, my doctor's supposed to have a portal. I'm like, I don't think my PCP has a portal. I've never seen one. So now I'm gonna have to call the doctor's office to find out where my portal is, because I really need
Let me
them to
know if they say they don't.
connect. Because I tell them, send all my information. When I see you today, I need you to send it to this doctor. And when you see this, I need you to send it to this doctor. So everybody's medical records are all together, so definitely fun stuff. And so for someone who's listening right now, who feels completely overwhelmed, so let's talk about your app, because I really want to get into some nitty gritty, the
Okay.
nitty gritty,
No.
the good stuff. So I want you to tell our listeners you developed an app, and I want you to talk about it. I want you to be very specific and that kind of stuff. And then if somebody wants the app, I want you to tell them that too. And so kind of walk our listeners through the app. What did you do? What made you to do this? What does it do? How does it work? That kind of thing. So we can get some real clarity for today.
Absolutely. So I was a critical care nurse and I ran a care coordination for older adults for 6 years. And that's where I saw and kind of got angry because I'm like, look at all this, because I knew how to get the information as a nurse and it took a lot of work, right? But once me and my nurses we would, get this information so that we could figure out, and then we'd interview our families, understand what mattered to them so that we could use that information to kind of come up with the best plan. And as I was like, well, not everybody can afford a private nurse to do this for them. So how can we do this in scale? And so primary record, when I saw this like law that's saying, hey, electronic health information people, if the information is electronic to a doctor, then it needs to be made electronic to families. And so that's when I was like, okay, well, if this is great, so how can we get information in? So primary record was built because I also got tired of electronic systems where you fill out a lot of forms and you don't know why you're filling it out, right? Like and you're doing these assessments and you're like, okay, well, what good is it to fill this out? So recognize primary record is every section in primary record was designed for that crisis and that care transition. So in primary record, how it looks is you can start with just yourself. We have a lot of families that don't quite trust it or don't know what it is, so they'll do a profile for themselves. And you build out your profile. So we've got a placeholder where you can dump your insurance cards for those moments that you forgot your insurance card at home. I have had offices photocopy my phone, but hey, it worked. And then there's places when you get into that stage of life where you have major legal forms and advance directives or post forms. I find it fascinating as a nurse. Those are still on paper. And you'll have to remember, so we have placeholders of uploading your advanced directives. We have a file folder that can easily, upload those documents. And then it's like you said, it's where are all the information? Do I have access to those portals? And when you go connect that portal and give permission for a primary record to go, and we get the history out of the electronic health record. So not just what's active, But I mean, I think when I pulled it, I still saw the epidural I had with my 17-year-old 17 years ago. I was like, oh, I forgot about that one. That was from Dr. White. So it will show like historical record, like pulling it all in. But we also have a place for notes, because what I started realizing as we went from office to office, sometimes what was said verbally wasn't always something I could find in the electronic health record chart after, right? Because the doctors are charting in a way to, make sure that they've done all the things to care for you and to bill. But then there's those like wonderful little nuggets of like, oh, you should do this, or, or follow up here. And so we know that families are taking notes. And so we have a placeholder for that. And so that the whole thing comes together around, it's a place to dump things. It doesn't have to be super perfect, because we have put in chat assistant, where there's literally an assistant, so that if your son came up behind and you have given him access to, ask questions or whatnot, and you can't talk on your behalf, and that he's getting that question from the doctor, he could literally put it in primary record, and it's going to answer like you were answering it, because it will read through any notes that you've taken at the doctor's office, anything that you've uploaded about your wishes or things that you want, and then looking at your clinical information and help guide him on, what's kind of going there, what's going on, and what are those questions that he should be asking back. So it's very important thinking about the data coming in, but for us, it's been, how do we help families use that data to make that caregiving experience, a little less burdensome on their brains, and to feel a little bit more clear on what's going. So there's a lot more stuff built in that, but yeah, I would love to hear questions that you have.
And so I think it's fantastic. So, definitely. So talk to the listeners. How do they find the information? So,
Yes. So we are on the screen. You see primaryrecord.com. That's the great place where you can, learn more about us. From there, you'll see a login or sign up button on our homepage. But we're also in the Google Play and Apple Store. So if you want to go right there, you can type in primary record, and you can sign up, have it on your phone. So we're on. You can access us through the web, as well as on your phone. So it's accessible anywhere you are.
okay. So I want to make sure I'm clear. So when I go sign up, when I get done with this and I go sign up, I want to make sure. So I sign up. I already know one of my doctors has an app. So do I just connect the app?
So you'll make your profile, and there'll be a place where you'll see patient portals, and you'll click on that. And then you're going to go search for the health system, like what's the big hospital that your doctor is associated with, Kim, just for this example.
I primary that they're not. I mean, the doctors
Okay,
in Texas are you have doctors that only work at the hospital, and you have doctors in private practice.
I
So
gotcha.
one of my doctors is associated with the hospital, but my primary care physician I don't think is. So
Okay,
I'll
no,
find it
and
though.
I know you will. But this is the beauty of our app. So we didn't design, because for me, technology in healthcare has to have a human element. So if you go to search, and you do not find it, there'll be like a yellow bar at the bottom that says unable to find my portal. And you click that, and you're sending our team a message. And usually we're asking you like, oh, send us your doctor's website or a phone number. And we will see, okay, do they have a patient portal? Then we've got to see, is it a certified health IT portal? That's always eye-opening for families and patients. And if they do, I can either go look to see how to connect it in, or I might be making a request, a new request to have, we have a partner that does all of the integrations with the different doctors' offices. But it does, when you kind of get all of those portals in one spot, then there's automatic refreshes. So there's the getting started, and then after that, it's just the place that you can just dump information.
Perfect. All right, Jean, it's been fantastic. This is great. I'm super excited. So now I can go home tonight. I'm going to connect all my people into one place, and then there's another part of me goes, do I really want to see it all in one place?
I know.
I'm
And you
like,
can
oh,
just,
it might be a little overwhelming. And
well,
so,
and it
but
may motivate you or I mean, if you just got off blood pressure, I bet you can be quite proud of yourself of everything.
I am super excited. I'm just getting healthier and healthier these days. So I'm super excited. So, Jean, it's been a
Wonderful.
pleasure having you on the show today. And we look forward to having you on again soon. Thank you so much.
Absolutely. And we actually gave a special code. So anyone listening, they can go to apply code under their account and put life happens, and they'll get a month free of the unlimited features. It's always free to use, but we just put limits around some of the features to help us make sure we can scale our business with our families.
Oh, thanks for the code. That's pretty
Yeah.
awesome. All right. Thanks
Yeah.
so much. Take care.
Thank you, Kim.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.